Francisco Rabia from Cedars-Sinai Heart Institute in Los Angeles, California. Title of the presentation is Present and Future Total Artificial Heart Technologies. There is a group of patients with advanced heart failures that cannot be helped by either transplantation or ventricular assist device. We know that these patients are the sickest patients that have this condition. We know that heart transplantation offers the best possible therapy for patients with advanced heart failure. There are also a group of patients that can be benefited with the ventricular assist devices. However, there is a minority of patients that either because they're running out of time, they are too unstable, and they have global failure of the heart that neither transplantation is not an option at the time because they're running out of time, or ventricular assist device is not an option because they have global failure of the entire heart, either because of the diagnosis or because there is structural damage to the entire heart. In this group of patients, the option of total artificial heart can be considered. The total artificial heart has been around for decades, but it has been in the last few years that its true potential has been recognized and its utilization has been increasing over the last several years. There are several diagnoses that has been utilized or have been accepted as main conditions for the total artificial heart to be used. And in the last few years, there have been some other diagnoses that have been added to the list. The current most common diagnosis is, of course, patients who are intermax 1 in severe biventricular failure, that there is no donor available for heart transplantation, and the patient only has a few days of life before they progress into multiple organ failure. And they have already failed other therapies, including temporary circulatory support systems. It is in this patient that the total artificial heart can be utilized successfully. Now, we have also shown that centers that have experience with the total artificial heart usually have offered the patient the best possible outcome. There are many centers that are trying to gain experience so they can become centers of excellence and be able to provide the best option for the patient. The centers that are very experienced have success rates of about 75% and even higher in some cases of being able to take the patient who is extremely ill and successfully bridge them to transplantation and offer them a chance of life. At the present time, with the Freedom Driver, more than 50% of the patients can actually be discharged home, so they can wait at home for a donor available for transplantation. The Freedom 1 driver will eventually be replaced with the newer technology, the Freedom 2 driver. In the next few years, we will see new emergent total artificial heart designs that are sophisticated and hopefully will provide patients also with the option of mechanical heart replacement and hopefully better successful outcomes.